fractures and aseptic loosening.
The International Joint Center is hosting its third consensus meeting in Istanbul today, and around 1,000 practitioners from around the world are listening in the new findings in the field of orthopedics, and the main focus of today is infection.
The conference highlighted wide-ranging issues, including the proper preparation of patients before orthopedic surgeries. Surgeons undertake immense pressure both before and during the operations, as maintaining the necessary hygienic environment is key to eliminate future infections. Not all orthopedic operations are conducted in similar manners, as surgical incision often vary depending on the implemented artificial prosthesis.
This meeting's aim is to help our patients that we have operated arthroplasty patients. There's a very important complication, one of the very important complications. Its rates about 1 or 2%. It means that if you operate 100 patients arthroplasty, it means that 1 or 2 patients can be infected. It's a very hazardous problem. And if we manage this problem properly, if we decrease from 2% to 1%, it means this meeting is quite successful. And there are 3 steps: management, definition of the infection, and prevention. Second one is prevention of the infection, and the third one is proper treatment of this infection.
World leaders in artificial prosthesis developers are also participating in the 3-day conference to showcase the latest developments in biocompatible surfaces at the implantable medical devices market.
My main field is hip and knee arthroplasty, prosthesis surgery. And we are discussing here mainly periprosthetic joint infection, prevention, treatment, and we should give all orthopedic surgeons the way of the treatment of infection and prevention of the infection. That's very important. We want to ask our patients, forget that their replaced joint and they don't feel there is the artificial joint. Our aim is they must forget their joint, artificial joint.
It's a various field in orthopedics.
According to experts, there are modifiable risk factors that patients experience before undergoing orthopedic surgeries, while some of the common factors are obesity, inactivity, and anemia.
Does excessive activity increase the risk of musculoskeletal disease, or does activity, by reducing obesity, for example, reduce the risk of musculoskeletal disease? We know that things like marathon runners or excessive running could certainly put a lot of pressure on the joints, hips and knees, but also gives them better health and better lifestyle, and by doing so perhaps also reduces the risk of musculoskeletal disease. So it is a very interesting and a difficult question to answer. But if I were to choose with being an athletic person and being active versus sedentary, because I'm worried about wearing my joints, I would choose the first one. Be active, be as athletic as you can, and don't worry about wearing your joints out. Those are good for you.
Artificial intelligence is a significant contributor in the field of orthopedics as it's become more widespread in diagnosing and treating musculoskeletal disorders.
Post-pandemic, huge changes to our lifestyle, not only just orthopedic conditions, but like cardiothoracic, pulmonary, other systems are also adversely affected by inactivity, sitting at home, not going out to open air, breathing proper oxygen, active lifestyle of walking, doing things. So these are also going to be significant impact and huge addition to the burden of musculoskeletal diseases that we have already seen.